Hi everybody, I'm going to do something slightly different this week for just talking about rheumatology and some interesting stuff that's come on. So a bit of a caveat before we get started into this. I have just used GPT to give me some of these. Don't go fact checking them necessarily, but there's just some interesting parts on this. A few of them I know are definitely correct, but we're just gonna talk about celebrities and historical figures that have had rheumatological conditions. Not gonna lie, I had to look up a couple of them up. Didn't know who they were. The first one being Selena Gomez. No idea who that is. Which is probably tells you, I looked her up, apparently she sings stuff, tells you about my musical taste. She has lupus, and I did actually know this. I talked about Selena Gomez in the past, although I didn't really know who she was or what she did. But one of the really interesting things about her condition is how significantly it's affected her kidneys, and she had to go through a kidney transplant because of that. So, yeah, lupus nephritis in all likelihood. So that connective tissue disorder, obviously, being lupus and affecting her kidneys primarily. Which is absolutely fascinating. One where I am on steady ground and I understand who this person is. Venus Williams with her Sjogren's syndrome. And I particularly remember this because she was diagnosed around the time when I started in rheumatology. So it was around 2011, 2012. And she had some time out managing symptoms and she struggled with fatigue and joint pain. And she returned back and she was in my presentations when I was teaching for a long time because she came back and she came second at Wimbledon despite having the Sjogren's syndrome, but was unable to win that particular competition. But fascinating turn of events, and also interesting in that the connective tissue disorders are slightly more common in our African American females. So she did fit that category quite nicely and demonstrated that you can overcome some of these inflammatory conditions and still perform high level sport. Carrying on, interestingly, Seal the singer, discoid lupus erythematosus, another connective tissue disorder. And as soon as you realise that and you remember what Seal looks like, specific form of lupus primarily affecting the skin, fascinating really. And so he has lupus, lots of connective tissue diseases in here. Alec Baldwin, the actor, apparently has Lyme disease. This is completely new for me, which Lyme disease given to you by a tick bite. You suffer from Lyme disease and you can get rheumatological symptoms, lots of fatigue, joint pains, that kind of thing. Totally new on me that from Alec Baldwin having chronic Lyme disease. So moving into some historical figures, again, you're really going to be stressing me if these are actually have factually accurate. For this because it's just come straight from the AI, but a couple of them I have heard before. So the first one I've got here is Julius Caesar. Apparently possibly had rheumatoid arthritis or epilepsy, and those historical accounts supposedly describing him as having severe joint pain and mobility issues. Maybe that's why he couldn't run away from everybody stabbing him when he was killed, obviously. One I do know, which is very, very interesting, is Renoir, the artist, and he had very severe deforming rheumatoid arthritis. And when you have a look at his artwork, you can see it changing through time as his hands became more deformed and he was unable to hold paintbrushes in the same way. Extremely severe arthritis. There are pictures of him and his deformed hands, even holding paintbrushes. That's a really, really fascinating one. And then another one where I'm on fairly steady ground, even though this is quite historical, of course, is King Henry VIII with gout, and that was well documented as sort of the rich man's disease back in those times. He was significantly overweight and he had a very rich diet, and they would drink a lot of alcohol, eat a lot of red meat, that kind of thing. And he suffered significantly from gout. And then my final one is Charles Darwin. Apparently he had rheumatoid arthritis or ankylosing spondylitis. They didn't know which, based on historical records. He experienced chronic pain and debilitation later in life, likely due to a rheumatological disease. So fascinating to go back, see who had these different diseases. I'm going to try and find some pictures and stuff and to put back into this video to make it see what we can visually put in here. Or if you're listening on the podcast, then you can go find this as a video on YouTube or wherever on my Substack. There'll be some links in there to have a look, and you can see some of the pictures. I'll put some of the artwork from Renoir in, for example, and that's really fascinating. Well, we do want to hear from you. You can comment wherever you're listening or watching this. Do you know any celebrities or historical figures with rheumatological diseases? It's always fascinating to learn more about these and what people had and what they overcame and what challenges they suffered because of this. It'd be very interesting to hear about that. Maybe I'll record some further videos on this, a little bit light-hearted interlude to our CPD learning on these subjects. So do sign up or subscribe or hit the like button, all that kind of stuff for me, and you can hear more stuff. And we'll learn about rheumatology together, and hopefully we'll be better at rheumatology as an audience and myself. I learned a few things, including who Selena Gomez is, which I wasn't expecting. So I'll see you next time. Have a good week, everybody. Bye for now.